It's Thursday night. It's I was going to say it's Friday and it's Crackerjack if you're old enough and from the UK. But unfortunately, it's Thursday night and it's 6:30, so it's not quite Crackerjack, but it is the Friday Night Live. And this tonight we are doing the Q&A session. So I do have a couple of questions that have been given to me. Otherwise, I'd have been sat here just looking at you. So at least I don't have to do that. So thank you to Charlie and Helen that put forward a couple of questions. So I'll start chatting on those lines along about them, and then hopefully someone will come and join in. If you're watching on replay, do put hashtag replay so I know you've watched it and I can say hi to you and say thank you for watching. It gives me a bit of a boost knowing that somebody's watching it. So do your bit for mankind and make me happy. So yes, so the Thursday night lives, fireside chat. So it's Q&A, and I think what we might do going forward is do this every month. Hi, little Rosie Sunshine. Thanks for joining. Let us know where you're watching from. That'd be great. So I think I might do these on a regular basis if you let me know if it's something that you want, if you find it helpful. Otherwise, we'll just do it sort of every sort of ad hoc when I can't think of a topic to talk to you about. So yes, so this week's is the live. Next Thursday, this time, we are going to be doing the social. So that's the virtual social. That will be it just in Zoom. So I'll start promoting that from tomorrow. So that's just in Zoom. It's not streamed into Facebook. It's not recorded and put into Facebook later. So it is a really safe environment. So if you want to come and just have a chat, ask a few questions, you're more than welcome to do that. So that's next Thursday night. And then the Thursday after that, so next Thursday is 22nd, the 29th. I will come up with a topic or see if I can find someone to come and join me, either recorded or live if I can work out, because Facebook have changed its streaming Zoom straight in. So let me think about that one and get back to you. So Charlie wants to know, how can I tell if I'm in perimenopause? There's no fixed science for this. There's no specific test. In the UK, doctors and medics work under the guidelines from the National Institute for Clinical Excellence, which advise on best practice. Depending on your age, with regard to perimenopause, will depend on whether they do blood tests to check hormone levels. So under 45, yes, there is. They should be offering you a blood test to check your hormone levels. However, you don't just have the one blood test, because your hormones fluctuate so much. They are, if you only do one blood test, they're only getting a snapshot of that moment when they took the blood. It's not sort of a history of what your blood's doing. So the advice is that you have another test, the same blood test, about 6 weeks later, to try and get a better idea of what your hormones are doing. Over the age of 45, you can be diagnosed on symptoms alone. Now, the symptoms, they're not a definitive that yes, you are in perimenopause. They can indicate you may well be, because some of the symptoms that you may get also can overlap with other conditions such as B12 deficiency, underactive thyroid, or vitamin D deficiency. However, if you've noticed a change in your menstrual cycle, it's more often, it's more irregular, more often, or it's changed in flow, in length, in any way, that is a sign that you could be perimenopausal. And especially if you're under sort of 40, that's worth going to speak to the GP about, because if it is perimenopause, you've got premature ovarian insufficiency, so you will need to get some treatment for that. Um, oh, okay, you're in Surrey. Oh, that's fantastic. And I'm in Worcestershire, so hello, Surrey. So yeah, so you need to have the blood test done. Yeah, period. So changing period cycle is a good indicator. Hot sweats again if you're having the hot flushes and things like that. If you are not sure and you're thinking about going to speak to the GP, keep a record of your symptoms. I do have a symptom tracker, and if you go to in the groups to the about section, you can download it from there. I'll just get it. Oh, I can't show my screen in here. So on the symptom tracker, I've put together, there's 2 pages full of symptoms. Score, you can score it out of 10. And there's a week's sort of tracking, and you could just print it off and redo it for every sort of every week, and then monitor it for a few weeks, and then go and speak to the GP. So we've got symptoms on there: hot and cold flushes, because some people have cold flushes, night sweats, poor sleep, insomnia, mood swings, anxiety, depression, brain fog, poor concentration, lack of confidence or self-esteem, fatigue, joint pain, muscle aches, bladder weakness, vaginal dryness, new allergies, things like I started with hay fever. So anything along that lines that could indicate dry eyes, changes to your digestion. If you're still eating your normal diet and you've not had changes, sort of major changes to it. Dry eyes, dry mouth, or burning tongue. Like I said, changes to your cycle or the flow. Different altered skin sensations. So I'm just giving Indy a few treats. He's just come up late. Regular bladder infections, changes in your body odor, changes in your teeth, your hair's thinning or you're losing it, you put on weight, palpitations, loss of libido, changes to your nails, they've got a lot softer, changes to your taste or smell, or dizziness or tinnitus, or any other weird and wonderful symptom that you're getting. You can add, there's lines free on the symptom tracker to add your own symptoms. So you're able to take it, do it for a couple of weeks, or however long you want, and then if you're taking it to your GP, they've got something to work off, rather than you sitting in the GP surgery and going, I don't think there's something wrong with me, I don't know what it is, I don't feel me, because they're more likely to go down there, oh, you're depressed, you need antidepressants. But if you go with the list of symptoms, especially if you get a really good GP, they will go, yes, that's perimenopause. And again, if you're over 45, hi Charlie, thanks for joining us. If you go to the GP with your symptoms, like I said, they should put 2 and 2 together. But if you're going very vague, I don't feel like I know what I'm doing. I don't know if I don't think there's something wrong. Because they're not all trained, you're likely to come out sort of with a prescription for antidepressants. So I do have a besides the symptom tracker that's in the about section, I do have a tip sheet for advice for going to speak to the GP. So if you want that, just let me know. So you can have that as well, because if you go, the more prepared you are when you go to the GP, the more chance you are of hopefully coming out, feeling happy that you made the effort to go. Because at the end of the day, when you go to the GP, you want a solution. You don't want to come out feeling more frustrated than when you went in. So I've got that resource for getting support from your GP as well. So just keep a track of your symptoms. That's the best way of doing it, and then sort of you can see how often they're happening. Is it just once every blue moon, or is it every 20 minutes? How much are they affecting you? The advice is for HRT, that it's recommended if the symptoms are affecting you, really affecting your life, your life. At the hot flushes, like every 20 minutes. And if you don't want HRT for things like hot flushes, there are alternative medications they can prescribe you, if you want to go down that route as well. So that is, sorry, I do talk with my hands, and I've got you on my phone at the side. There's a few seconds back from being live, so I keep seeing my hands twirling. So yeah, so that's how you can tell if you're in perimenopause. Keep a track of it. That's the best thing. And again, if you're under 45, 2 blood tests, at least 6 weeks apart. If you're over 45, the GP may well do blood tests as well, just to rule out things like underactive thyroid, vitamin D, B12 deficiencies, because some of their symptoms do overlap with perimenopause. So I hope that helps, Charlie. Let me know if you need any more information. I'll be covering sort of what menopause is and symptoms and all stuff like that again next time I do a training. I'll just keep, every time I do a training, I'll just cover that as the first section. So that's that one. The next one is managing anxiety. So anxiety is a big one. Psychological symptoms are a real challenge with some people, depending on some people really struggle with them. They can get anxiety, some people can get the depression, some people can get really bad depression, some people can get psychosis. So it's really, if you're struggling like that, you really need to make sure you're getting some help. So anxiety, it can be mild. Everybody has anxiety differently. Everybody is triggered differently for their anxiety. I know before I realised I was perimenopausal, I was struggling sort of with anxiety as well, but I just sort of put it down to the pandemic. Mine was only sort of a mild, not wanting to leave the bubble of the area that we live in, and sort of losing confidence and things like that. So the main thing, if you've got really bad anxiety, is getting some help. If you're employed and your employer offers an employee assistance program, access it. With EAP, normally you will phone up, you will speak to a therapist straight away, so you're not having to get through the GP, get through the gatekeepers of receptionists. So you would explain your situation, how you are feeling, what's going on, and then they will recommend what they feel is the best sort of path for you. EAPs are, you can phone up for like a one-off call, and they can, I'm having a really bad day today, I can't get through the day, and then they can just give you some advice. Or they may say, I think you need a course of therapy, so then they will refer you to one of their therapists. Going through EAP, you're going to get help so much quicker than you will with the NHS. When I do the occupational health, speaking to people all over the country, the waiting list in some places for therapy can be 6 to 9 months. So if you're got any access to an EAP program, and you need someone to talk to, I would go down that. Don't think twice about it, just use it. Because like I say, you're better off going down there than going through the NHS, because you could be waiting, till the end of time for something to happen. There's also, crisis support people. There's like the Samaritans. There's tech. If you can't talk to someone, there's Shout, who you text. There's Couth as well. There's loads and loads of crisis support out there, and you don't need to be on the fact that you're suicidal and stuff like that. It's just the fact that you are, you're struggling. If you need help and you need to speak to somebody, just pick up the phone and ask for the help. Don't keep struggling yourself. If you're employed again and you're in a big company, ask for an occupational health assessment, or support, because they will come along, they will get an assessment, they will get your medical history, because this is what I do on a day-to-day basis, get medical histories, and then we'll come up with recommendations for reasonable adjustments to help you in work. So depending on, if your anxiety is around work, do you need your hours changing? Do they need you to look at your shift pattern? Do you need, your workload reviewing, etc., etc., and etc., and making sure you're getting to appointments. Oh, that's just going back to the blood test. Little Rosie Sunshine said she got a printout of her blood test results and that helped her understand what was going on. So that's a really good idea. I think if you've got the NHS app in the UK, I think you can access your results through that as well. So with anxiety, there's the Calm app as well. You could use that or something similar, and or do some mindfulness. You want to try and bring, because when you're anxiety, you've got your cortisol's really high, you're stressing, you're on your fight or flight thing. You want to try and bring yourself down into that rest and digest, making sure you're calm. So doing something relaxing, something you enjoy. Breathing techniques, like like I said, there's the mindfulness, there's breathing techniques. Just maybe taking up yoga and trying doing that yourself, or reading, or hugging someone, boosting your oxytocin. I think you keep saying oxytocin will override the can't remember what's the word, the stress hormone cortisol, and that will help bring it down, which will help lessen with the anxiety. Making sure you're getting enough sleep. If you're not sleeping, that will make your anxiety worse. You really need to make sure you haven't got in a good routine. Try and go in, like we talked about sleep last week. Go to bed and get up at the same time every day. Keep to a really good routine. Try making sure that your room's calm and cool, and you're relaxed before you go to bed. If you're stressed when you go to bed, you will not get sleep. And if you're stressing, making sure your blood sugar remains stable, because if your blood sugar drops in the night, that's what will wake you up. So making sure you're getting enough sleep and you're getting good sleep. Regular exercise to calm the body down, allow, boost that serotonin as well. Again, yoga, doing something like yoga helps with the breathing and the calming down and getting into the rest and digest. Taking time for yourself. Like I say, this is all the stuff we talked about during the self-care challenge and in the workshop. Making sure you're having that time for you. Doing things that you enjoy. Being with people you like to be around. Don't stay away from the people that are draining, that are toxic. You don't want to be doing stuff like that, because that will just make you feel worse. Putting in boundaries as well to stop you getting overwhelmed. Especially, if there's a lot of anxiety around sort of workload and stuff like that when you're in work. Speak to your manager. If you start struggling, the sooner you can let your employer know, the sooner they can put in stuff to help you. Because otherwise you end up really struggling, and then making mistakes, and then you get performance plans, and then the anxiety and the stress comes in, and then there's disciplinaries, and all for the fact that you're not staying. I'm having a really bad day, I'm really struggling today, I've got no confidence, or my brain fog's horrendous, or my anxiety's through the roof. Whereas they can then pick up and go, oh yeah, that was the day she wasn't so good. So being really open, putting pressure on it, saying no. These boundaries. Why do you always say yes? Why? Is it because you've always done it? So think about saying before you say yes. Is it something that somebody else could do? Or if you say yes, is there something you can give them to do instead? Yes, I can do that, but you have to do the other 25 things I was going to do instead. But you have to, it's being honest. Another thing to do with anxiety is doing if you're like writing, doing journaling, or if you've got loads of thoughts going through your head and you don't know which way to turn, your head's buzzing, just do a mind dump and get them on a piece of paper. Or to do a to-do list, but don't, if you're getting overwhelmed and things like that, make sure your to-do list is not too big, because if you've got a long to-do list, that will make you even worse. Just put a couple of things on it and cross them off, then add another couple on, but get stuff out your head. Making sure you're eating a healthy diet. That way you're trying to helping prevent and reduce weight gain that can lead to lots of even more anxiety, or a drop in your self-esteem because you're not as thin as you were a few years ago. So it's making sure you're taking control of the, try and work out where your anxiety is, what the issue is, and trying to put things in place to help prevent it. Again, talking to your GP. If you feel it's out of your anxiety is out of control, you're not able to do the things you would normally do, it's affecting your life, etc., etc. Make sure you're reaching out for that help. You can't do it. You can't always do it on your own. If it's, speak to a friend, speak to your GP, speak to your boss, speak to the family. Get them helping you as well. So I've got a resource, 10 amazing tips to help manage anxiety. And there's a recommended reading. So I've put links in for the NHS, No Panic, which is a crisis support. There's some breathing exercises from the Priory. There's Kooth, which is an online chat-based service. There's the Samaritan's phone number, and Shout for the UK to text a crisis volunteer. And I've added a to-do list at the bottom. So you can, when you've got all these jobs to do, you can add them onto the to-do list. And again, that's blank, so you can just keep printing that off and sticking it up on your fridge. But anxiety, ask for help. Don't struggle with it. So that is those are the questions I got asked. So is anyone still with me? Are you still there, little Rosie, or is it Charlie that's still with me? You just put in the comments which one's still here. Just write a hi. Or have you got any other questions? Okay. I don't think I'll just double check and make sure no one's posted any questions. Please hold. Your call is important. Still no. So I'll talk about sort of linked to sort of anxiety. This is more sort of workplace based. It was a post I saw on LinkedIn by my trainer Lauren, and it was called the Dark Cardi Club, and asking, have you got a Dark Cardi Club in your workplace? So the idea is you keep a couple of dark coloured long length cardigans, either black or dark purple or navy blue, and they're on the floor of each workplace if you're in multiple story offices. So if someone has a really heavy bleed and they think they're leaking, or they've had a really bad hot sweat and they don't want everybody noticing, they can grab the cardi, put it on, and then walk to the bathroom and allow themselves to freshen up. Or if they're having, like some people I said don't have hot flushes, they have cold flushes. If you're sort of in our t-shirts and you've got air conditioning and then you have a cold flush and you're really cold and you want to warm, you can go and grab that cardigan. So I think that's a really fantastic tip to mention, especially if you're still working, is mention it to your wellbeing team or HR or your manager and say if they think you should be doing something like that. I will definitely be recommending it in my reports going forward for any employee I talk to that's suffering with menopause or any sort of menstrual issue. There was a plop there. Oh yes, that soon reminded me about the training I booked him for. The other thing to do is making sure you've got emergency sanitary ware in the toilets, and that's in both men's and women's, because of those who are transgender or non-binary or gender questioning, they've got access to it as well. So that's really important. I've actually been to a workplace where they had it in in the toilets, which was excellent. And the other idea that she said was have a wash bag with things like Kirby grips and scrunchies. So, and you know, and changes of pants and trousers. You know, so if you're having a hot flush and you need to cool down and you've got long hair and you've forgotten to put it up today, I wear mine up most of the time because otherwise I just look like a witch. So you can go in and put your hair up again if you've had a heavy flood. You know, if you don't always have underwear with you, if there's some spare somewhere, that would be really good. So it's making sure it's, you know, looking after, because if you haven't got access to the sanitary wares, or if you've soaked through into your underwear, it does that causes that anxiety. Is you know, is it going to soak through to through my trousers or onto my skirts and stuff like that? So having something like that in the workplace, I think, is a fantastic idea. And like I say, I will be putting it in recommendations for reports going forward, and including it in my talks when I talk about getting help from your employer. So, yes, so was that. I don't think anyone else has come up with any other questions. Oh, yeah. Rosie says she found through her menopause, she found massages helped. Yeah, I mean, that is, you know, massage is really good because that gives you, that's me time. It's that time where you're relaxing, you're able to go into that rest and digest while someone pummels you. Depending on the type of massage you have, you don't want to be going for like the Thai massage where they really hurt you. So that's not quite as as restful. But that's a really good idea. I mean, there's reflexology and stuff like that. And you know, if you go for a massage, and you can go to if you go to an aromatherapist massage as well, they could tailor the oils to help with your symptoms as well. And I'm still in the midst of putting together a resource on oils that may help with menopause. Aromatherapy oils with menopause. I've got to finish that off, and and the crystals as well. I'm still working with the crystals. So if you're a little bit woo woo, I do sort of have a couple. I have them rose quartz heart. I keep that on my mouse mat, and some tiger's eye in case I need a bit of grounding. So I'm working, sort of putting those together. I've just got to finish those off, and I'll be releasing those in the next couple of weeks. In fact, I might do a live on sort of when I release those on sort of crystals and aromatherapy, you know, essential oils. Having because in a sort of previous life, I was a complementary therapist. I did reflexology, aromatherapy, head massages, ear candling. What else did I do? I learned to do man impaired, holistic facials. I then went and did a whole load of other courses. I did Korean hand massage, which was very much different but similar to reflexology, but it was in the hands. Reflexology, I don't know if you know that the body is reflected in two hands, or both your feet, or in your ears, or on your face. But Korean, the body is just on one hand, so you do two hands. And I did a Tibetan head and hand massage as well. So I did, and then I learned Bowen therapy as well. So I've done a whole load sort of in the past. I haven't kept them up, so I'm not very I'm not very up to date with them. And I was saying to Rosie in a text that I'd done reflexology, and it scared me that it was 20 years ago when I did my training. It doesn't seem that long ago. So you use it to do it, like I say, so off track. So complementary therapy, having massage and stuff like that, get in that me time is really, really important to try and bring down that cortisol level and allow your body to go into the rest and digest, because we don't want to be in fight and flight all the time, because that's when if you're in chronic stress all the time, that's when you end up with heart disease, high blood pressure, reduced immunity. It can affect your kidneys. It can lead to Cushing's disease, which is when the adrenal glands produces too much cortisol, and it can lead to kidney problems as well. So it's really important that we look after ourselves. Right, okay, so have you got any questions, little Rosie? Yeah, little Rosie teaches yoga, so you might have to get her in to do some yoga for us. What type of yoga do you do, little Rosie? Just write in the chat what type of yoga you do. I do yin go to yin yoga on a Sunday morning to help me loosen up, because I hurt my knees a couple of years ago walking the dogs when they're a lot younger down a hill in Wellies in February. Strained one knee, then hurt the other knee, and just as both of them were improving, I then twisted another knee. So I'm only just getting back to being able to walk up and downstairs normally. I was using a walking stick to get downstairs for about a year. But you don't really want to hear about my injuries and my frozen. I won't talk about my frozen shoulders. Okay. So if anyone's got any questions, if you watch on replay, like I said, look at the hair. It's wild again. If you watch on replay, do put hashtag replay into the comments. The computer's not going to blow up if you do that. It just helps me know who's watching it, and I can see if you've got any questions. So, oh, that's a good idea. Yeah, I used to do a bit of using Rosie was just saying that she does reflexology as well. She uses essential oils as well. When she's doing reflexology, which is, you're getting two hits with one. You're getting the benefit of the essential oil plus the reflexology, which is really, it's a fantastic therapy. Reflexology and Bowen. Yeah, I did. I used to collect certificates. Reflexology and Bowen, I think, were mine too. I'll talk. When I do the talk on essential oils and crystals, I'll tell you the story about when I went on the crystal course and I thought they were all mad. But yeah. So, have you got any questions, little Rosie? If not, I will let you all get on with your evening. So, like I said, next Thursday, 6:30 is the social. Again, that's just in Zoom. So please come along to that if you're available. It's a safe space to come and talk, to come and ask questions. So it won't get. I'm not going to record it and put it in here so everybody can listen to your issues. So don't worry about that. And by the by, while I'm just waiting to see if Rosie's got any questions, thank you to the ladies that have agreed to do the main piece of advice. Okay, Heather. Oh, I did some of that the other week. Oh, fantastic. What would be the main piece of advice you would give to anyone impacted by menopause? That's a really, really good question, but I think it would depend on how it's impacting them, what their main symptom is. But other than that, is managing their stress. bringing the cortisol levels down, because if your cortisol levels are high, it will worsen the intensity of the symptoms. Recent research said if you've got anxiety around hot flushes, so you have your hot flush, which then causes anxiety, and because you're dreading the next one, and you're sat there thinking, oh my god, when's it going to be? How bad is it going to be? Am I going to soak through my top? Is my face going to go red? Is everybody going to know? And that anxiety and that cortisol, that will make that next hot flush worse, which then makes the anxiety worse, which makes the hot flush worse. So it's a vicious circle. So it's bringing down bringing down that cortisol level. So it's making sure that you're having the me time and asking for help. You know, at the end of the day, you shouldn't have to suffer. Whether you go on the HRT, go through the GP and get HRT, or you go down the lifestyle route, which is what I do with the coaching. You know, it's finding what works for you. And if you're going down HRT, there's nothing stopping you doing the coaching as well, because the coaching will help reduce that anxiety, because you're getting that accountability, and that can help. If you're using topical HRT, that can help improve your absorption of your HRT, which helps you get a better effect from it. So I hope it's a bit vague, but manage your stress and ask for help. So I think that would sort of be the main advice for sort of anyone who's impacted by menopause symptoms. And talking to somebody. Don't keep it to yourself, because it can be very isolating. So reach out for help and manage the stress. And if you're struggling with stress, don't forget I've got the resilience assessment that I can share with you. So that scores your stress level, and then you've got the wheel of life to try and pinpoint the area of stress, so you can know where you need to set some goals to bring down that stress. And that comes with that free 20-minute call, so we can talk through it. And if you're struggling setting goals, I can help you with setting your goals, talking through your results and things like that. So there is that available as well. So, right, I think we will call it a day. So thank you so much, little Rosie, for joining me. Oh good, I'm glad you enjoyed it. I'm glad I had someone to talk to. It's a bit like being on a phone call with a really big delay. So thanks very much for showing up. Hope to see you in the social, where I can see your face and actually talk to you. So like I say, I will be starting to promote that from next week, and just an advert as well. If you're near Bromyard on the 19th of September, I know it's a Thursday night, I think it's the 19th, I'm going to be doing an in-person talk at Oakland's Gin Cafe and Gin Bar. So I won't be drinking any gin because I'll have to drive home, but I will be there live. I'll be signing autographs in the corner. So you're more than welcome to come to that if you're near the Bromyard area. So have a fantastic evening. Thank you, Charlie, for popping in and for your question. Thank you, Helen, for your question. Do let me know if you've got any other questions. And again, like I say, I think we'll probably I might do this again next month and see how we get on. But don't be afraid to ask questions if you've got a specific question. My psychic powers aren't very good. I don't know what they are, so you do need to tell me so I can help you. And again, thank you to all the ladies that have agreed to do the market research. I have done the first call today, and we've got a few booked in over the next few days. So hopefully that will give me some really good pointers of what you're wanting going forward, and it's not just me guessing. So have a great evening, and I will see you soon.